It's been years since the COVID-19 pandemic first disrupted our lives. But as we reflect on how the world managed, and in some cases failed, to control the virus, one story stands out as a dramatic turning point. A single person, known as Patient 31, became a symbol of how one individual's actions could ignite a nationwide outbreak. This story isn't just about her. It's about a secretive cult, controversial public health measures, and lessons we must never forget. Setting the stage. In early 2020, South Korea was seen as a model for controlling the virus. By January 20th, the country reported its first case, a 35-year-old woman arriving from Wuhan, China. The government acted swiftly, isolating her upon arrival. Over the next 4 weeks, the country reported just 30 cases, most of which were quickly traced to travelers or close contacts. South Korea seemed to have the virus under control, with rigorous testing and contact tracing. But all of that changed in February 2020 with Patient 31. Who was Patient 31? Patient 31 was a 61-year-old South Korean woman who was a member of the secretive Shincheonji Church of Jesus. This controversial Christian sect was led by a man who claimed to be the second coming of Christ. The group had around 240,000 followers and was infamous for its aggressive recruitment tactics and alleged brainwashing. The fateful days? Patient 31 had no known travel history to Wuhan, but she had been active in densely populated areas. On February 6, 2020, she was in a minor car accident and went to a hospital in Daegu. Doctors noted she had a fever and symptoms of COVID-19. They advised her to get tested. She refused. Instead, she attended 2 crowded church services on February 9th and February 16th, both with over 1,000 attendees. In between, she visited a buffet restaurant, traveled in taxis, and stayed in hotels, all while experiencing symptoms. Finally, on February 17th, she agreed to be tested. The result? Positive. The explosion. In the week following her diagnosis, South Korea's confirmed COVID-19 cases skyrocketed. February 17th, 31 cases. February 24th, over 970 cases. March 2nd, over 5,000 cases. Daegu, a city of 2.5 million, became the epicenter of one of the largest outbreaks outside China. Nearly 2/3 of South Korea's cases were linked to Shincheonji Church services Patient 31 attended. The role of the Shincheonji Church. The Shincheonji Church became a focus of national outrage. Leaders initially refused to cooperate with health officials, withholding the names of members who attended services. Authorities accused them of obstructing public health efforts and even filed charges against the church's leader for manslaughter. Under immense pressure, the church eventually handed over membership lists, revealing thousands of people potentially exposed to the virus. Lessons learned. In 2024, looking back, Patient 31's story offers critical insights. The ripple effect of individual actions. The virus's exponential spread shows how one person's decisions, whether out of ignorance, fear, or defiance, can impact millions. The role of trust in public health. Patient 31's distrust of medical advice and the Shincheonji Church's secrecy amplified the crisis. Public health systems thrive on transparency and trust. Preparedness matters. South Korea's success was no accident. The country learned hard lessons from the 2003 SARS outbreak, investing in infrastructure and preparedness. Balancing privacy and safety. While South Korea's use of personal data helped contain the virus, it also raised ethical questions. How do we balance public safety and individual rights in a crisis? The legacy of Patient 31. Today, as the world moves on from the pandemic, Patient 31 serves as a stark reminder of how fragile control can be. It only takes one person to undo the efforts of many. Her story is a call to remain vigilant, to build trust in public health systems, and to be mindful of the power of our individual actions. What do you think about the measures South Korea took to handle the pandemic? Should governments prioritize public health over privacy in emergencies? Let us know in the comments. Until next time.